As per usual, every Tuesday we are joined in studio by David Hain. David is an internationally certified addictions counselor, and David has been doing this for many, many years. So he's certainly one person who knows what he's talking about when it comes to all kinds of addictions. Good morning, Dave. Welcome.
Morning, Jeremy. Great to be here.
It's a pleasure having you every week. Now, Dave, we've been covering quite a few topics, and this one is specifically geared at people who have addicts in their families, friends, best friends, partners, whatever. And as we know that when people are in active addiction, they don't make the best choices and decisions all the time, and that impacts on those people who are not in addiction. So we're using this series to look at issues and just supporting families and friends of addicts. We've been looking at quite a few topics. This week we're talking about how do I help the addict choose the right treatment program, what is better, going away to a rehab or getting into counseling. And Dave, before we get to the question, I just want you to recap what we've been dealing with over the past few weeks, and just in terms of us talking about the training workshop that we threw around last week, and it sort of blossomed into something quite awesome. But we'll be giving you feedback on that. Just take us through what we've been talking about over the past 8 weeks or so.
Okay. Well, really, this whole series has been geared at the families. So it's been looking at a variety of topics, enabling, am I enabling or not? How comes I can't fix the addict? How comes, when these things that I'm trying aren't working anymore? What do I do with their aggressive behavior? What do I do with abuse? What do I do with broken trust? So all the topics around addiction. What do I do if it's a teen in the family? And how do I know whether they're addicted or just experimenting? So
Right.
Really looking at, how do we cover those topics that all the families have going around in their discussions or in their minds anyway, and just put them out there so that people can benefit by hearing, some ideas on it.
What are some of the main questions that you've been faced with? Because people do contact you and you meet with them and you counsel them. Well, what are some of the big questions that people are asking you?
Well, the big one right up front is, what do I do to help my son, daughter, spouse come right? And people still, even though they're the family, are more concerned in their family member coming right than they are getting help themselves.
Right.
So that's always the initial contact. But as I work with the people, they're realizing, wow, I need somebody to talk to. I need someone just to help me keep my sanity together and to make sure that I'm safe in my own home and safe with my emotions.
Right. Are people taken aback when you kind of indicate to them, listen, before you help the addict, you need help, and you look at them and they need help? Are people taken aback when that is sort of explained to them?
Not really. It actually is more of a look of relief or a sigh of relief that, wow, I finally have someone to talk to, because there's so much that stays hidden in addiction. There's so much shame. There's so much embarrassment. There's so much covering up for the addict. And also the addict's aggressive words are often telling the family members that they're the one with the problem or it's all their fault. And so finally being able to hear that, no, they are okay, and that all this behavior is really normal in addiction actually brings comfort and brings relief to the family members.
Right. So, Dave, you've been in touch with many people over these past weeks. How are things going?
Things are going really well. I'm in Plumstead every Wednesday, and I'm there from 10 to 4, and those slots just have filled up week in and week out, and I already have people scheduled for next week there. I'm seeing people Tuesdays before and after my time here on the show, and those things are staying filled up. And also last week we put out a call to people who would like to be trained to start up groups in their communities. And I've gotten over 25 people
Awesome.
who've contacted me from all around Cape Town. So we're really trying to get clusters of people in certain areas so that we can home in on a church here and a church there,
Right.
as a venue to use.
Okay, so if there are any pastors or leadership listening this morning, please will you contact Dave after the slot if you are willing to give up a venue or donate a venue for a period of time so we can get the groups going. These groups will focus on what, Dave?
Well, the groups will focus from two areas. One, groups that typically people would call support groups, groups for the family members to be able to come in and share their experiences. The other groups would be groups for the people in addiction or in recovery. I've written 2 books. One's called From Addict to Disciple, and the other one is called The Heart of an Addict. And they're intended to be curriculum for people going through group studies. So it's a discipleship program, but also a learning and caring program to really bring the support that people are looking for in the midst of addiction. And I guess while we're talking about the groups up front, just before I came on the air today, I did meet with a woman from Macassar who's very keen to get training going out there. So I'm not going to share her name and number over the air, but if anyone is from that Macassar area and saying, wow, I'd like to be part of that, please send me a WhatsApp or an SMS, and I'll put you in touch with the woman out there.
Okay. There's no specific criteria there that one is looking at for people who are going to be hosting these groups or leading these groups, is
well, I look at 3 categories, and it can be any mix of the 3. So one is someone who's already walking with the Lord, so is solid in their Christian walk and has an understanding of the Bible. The second would be some understanding of addiction. They don't have to have been addicts. They don't have to have had addiction in the family, but either some understanding of the devastation that addiction brings and or willing to go online and study, what are the effects of the different drugs and the different things out there. And then the third, pardon me, the third category really looks at comfort in working as a facilitator of groups. There are people that would be just a natural at leading groups and facilitating discussion. There are others who work better one-on-one and work better in more of a mentoring role or a big brother, big sister sort of role, a nurturing role. So really looking at where's your best fit and then coming around that and equipping you and providing resources so that you're comfortable to get out there and start helping.
Okay, awesome stuff. It sounds really exciting. And I can't wait for the training to start as well, because I want to go for that training as well, because it's something that really interests me. And I'm sure all of us working together can make an impact where we can help turn the situation around.
That's the idea. Part of my vision would be that every community would have a place, be it a church, a civic building somewhere, but would have a place where addicts could come, where teenagers or younger kids just experimenting could come, where friends who say, their friend at school is now starting to make wrong choices and they're alarmed by that and they need somebody to talk to, where families could come and say, how do we help and how do we cope? And so, really just a spot so that people don't have to travel an hour and schedule this, that, and the other thing just to get answers as to what they should do next.
Right. As per usual, if you've just tuned in, my guest is David Hain. He's an internationally certified addictions counselor, and he speaks to all areas of addiction. If you have any questions for him, you can send through those SMSs right now, 083-788-9494, 083-788-9494, and Dave will be more than happy to answer those questions. Also, listen out for his contact details after the segment here on the Tuesday edition of the 9 to 12 show. Got to pay the bills very quickly. When we come back, Dave and I will be chatting about how to help the addict choose the right treatment program. What is better, going to a rehab or getting into counseling? Dave will be unpacking that for us after the break. Stay tuned. 21 minutes after 10 o'clock, my guest in studio is David Hain, internationally certified addictions counselor. And Dave, today, as you join me every week, just after 10 past 10 on a Tuesday, we're going to be talking about and asking the question, how to help addicts choose the right treatment program. Is there a right treatment program for addicts?
Well, there's a variety of options.
Right.
And so I think in understanding how to choose the right treatment program, we need to understand the options. So, people who counsel addicts should be trained in doing that analysis and doing that assessment. So I'm not saying that the parents know or even the addict knows, but I'd like to just run through the different levels of treatment care so people can get a feel that, it's not just, oh, I know that one rehab down the block, or I know this other place. So a first option could be just a support group, maybe going to things like an overcomers meeting or an AA or an NA meeting, and that's often something that's good for someone in maintaining their recovery, where they just want to stay connected, they just want to be involved, they just want to be plugged in, much like a home group at church. Second is an option is an outpatient treatment facility, and that's typically once a week counseling, which can either be a group or an individual session. Maybe it's one of each, one group and one individual session each week. The next level would be called intensive outpatient, and that's where the person really needs to be there 3 or 4 times a week. An intensive outpatient really means that they need to get 6 to 10 hours of group and individual counseling every week for a period of time. And the determining factors in some of these is the stability of their environment, the stability of the home they're living in, the whether they're working or not, things like that, their medical condition. The next level would be a day treatment program, and that's typically 5 days a week, up to 6 hours a day, where and they're often at a hospital facility or a medical facility where people go sort of 9 to 2. There are some rehabs that run an outpatient day treatment center also, where people can come sort of 9 to 2, 5 days a week, and they're sitting in a variety of groups. They're getting individual counseling, they're getting career counseling, they're working with a caseworker, a social worker, that sort of thing. Then there's residential rehab, and residential rehab can be 28 days, can be 3 months, 6 months, 12 months, any length. And really, that you look at someone who, I describe it as their boat is out at sea bouncing around in the storm, and they're really at risk of going under. And they need a safe harbor to come into just to get out of the chaos, to get out of the craziness, clear their head, get some space, and begin their program. Not that the rehab is the answer to everything, especially if it's just a 28-day one.
Do you think that we kind of expect, and we've been made to believe, that rehabs are the answer to solving the addicts' problems and curing the addictions in some cases?
I think in most cases we're led to believe that rehabs are the answer, and especially if you're paying $25,000 or $35,000 for 28 days in a residential facility. The hope, the dream of the people paying that bill are that this will be the answer. This will be the time that my loved one comes right. Unfortunately, the success rate of those 28-day programs typically worldwide is around 3 or 4%. As far as people staying clean and sober for years.
And could the reason for that be that rehabs with such a short program is merely an intervention strategy in terms of just breaking the cycle?
Very much.
To gain a bit of stability?
Very much. It's a behavior modification strategy. It's a cognitive therapy strategy. By that I mean they're getting the addicts in a place where they can change their behavior, try to establish new patterns of behavior and new habits, new interests to replace the old interests, and then cognitive therapy, meaning they try to change their stinking thinking into good thinking, and recast a vision or get refocused. So they're good at doing that, but often they may not have the time or even the focus to get at the wound, to get at the real root cause of the person's addiction anyway, and to be able to handle it in such a short time.
Okay. Look, I don't think I'm asking the question because I'll share an SMS that has just come in. I'm not asking the question because I think it's a bad move.
Okay.
I'm just asking the question in terms of the reality of the situation, that it's not a cure. It's not a quick
Correct.
fix to go into a 28 or 30 day program, and people need to know that.
Yes.
Because you come out of 28 or 30 days in the rehab, you relapse, and there's major disappointment within the family, the people who paid the bill. And I think people need to be realistic about that.
That's right. And again, worldwide, if you say 3 or 4%, so we're saying 4 out of every 100 people who go to a 28-day program are still clean and sober years later.
Right.
Okay, so it's not the quick fix for the vast majority.
Right.
It is an opportunity to begin the process.
What are your thoughts on, because I think rehabs are normally associated as a safe place for people who are abusing substances. What about people who are gambling addicts, who are porn addicts, and all these other non-substance addictions? Would that be a place for people to go and break the habit as well, or at least the cycle?
Yeah, and there are rehabs and centers, outpatient and inpatient, for all of the addictions, and they do serve that purpose very well. It's that place. If you think that boat being beat up at sea, it's coming into a safe harbor where they can be anchored and begin to patch the leaks, so to speak, and begin to repair the boat so it's not going to go under and end up at the bottom of the ocean. So they really serve a valuable purpose to get out of the chaos, get out of the craziness, and get into a safe space. Even if it's just for a month, it's still getting into a safe space where behavior can start to change, and you can start to get serious about wanting to change. And
Right.
part of, in rehab's defense, a large part of the people who go to rehab don't want to change. They may be feeling they're forced to go by their families, and so they're just going to sort of keep people quiet for a while.
Sure. What are the other options if rehab is not the ultimate answer for the cure and the turnaround we're looking for? And please, I want to put this out on here that Dave and I, we are not anti-rehab. Okay,
No, not
not
at all.
at all. It's a very important part of treatment, and it's a very important space where treatment takes place. So if rehab is not the answer for some of the people, what other treatment options do we have as family members of addicts, Dave?
Okay, well, we talked about the outpatient ones before, be they intensive or not. And I think the importance, if we look at rehab, maybe longer rehab is the answer. So if 28 days may not be the answer for your case, for your family member, then think about 6 months, think about 12 months, or think before they go to the 28-day program, what are we going to do for a continuum of care? What are we going to link them into for aftercare the day they leave that program? So make it a package deal that the addict, when they're going, understands this is going to be at least a 12-month process here. This
Right.
might even be a 24-month process. So we're looking at rehab plus aftercare. We're looking about a halfway house or a sober living home, some safe space to continue to live after that 28 days, because we don't really feel right up front that it's going to be safe to come right back into this environment, into this community. So really looking at all of those things right up front as a package. And so that's why it's so important to have the family meetings up front, whether you call it an intervention or not, but have the family planning meetings so that we can all agree right up front, this 28 days isn't the answer. It's just the start. It's just the beginning. So let's plan 6, 12 months, 18 months out what we're looking for and what we can all commit to,
Right.
because that's a long commitment from the family's part
And that
to
that
be
could
there.
that could be scary if you have to plan recovery for an addict and yourself over such a long period of time. How do we make this realistic and less fearful for families of addicts? Because I think a lot of time people go for the 30-day program because that's kind of the quick fix, and
Yeah.
it's going to break the cycle. But this is a long-term battle that is being fought here.
That's right. And the reality is the person's been in addiction a whole lot longer than you were planning to try to set up the recovery. And so I come from that standpoint. And the reality of addiction is this person may end up in Paulsmore for 6 months, 12 months. You have no control when they're going to be arrested, when they're going to go to prison, wherever the prison is. So you have to look at that long term. And the things that I hear often involve job, house, a child. This addict who's been ignoring their baby for 3 years in addiction all of a sudden says, but I can't go away for 6 months because I'd miss my baby.
Right.
So we just have to be realistic that, the number of people that a quick fix works in this might be 1 in 1,000. We as believers will pray for someone bound in a wheelchair to be healed. And not all 1,000 people we pray for jump up out of the wheelchair and are
Right.
instantly healed.
Sure.
But that doesn't stop us from praying.
There we go. And we firmly believe that prayer is the solution, and God does heal that illness, that disease. Is there are there any programs for gambling addictions, and what do they focus on? This is an SMS that has come in. There's quite a few SMSs that have come in, Dave, so we'll just have to quickly move through those.
Yeah, I think the key with any addictions, be it gambling, cutting, eating disorders, porn, what have you, things that are process addictions rather than substance addictions, is that they need to be treated the same way. The same emotions are involved, the same quick fix, the same instant gratification, the same shame and guilt, the same rush, the same denial. Everything is the same. So that I urge people, regardless of their addiction, to say, look, this is an addiction, and I do need help as an addict.
Right. A comment coming in from Anonymous. I think addicts need rehab and aftercare. I have experience with my son's support group. My son support group is also important. Then a heartbreaking question coming in here, Dave. Dear Dave, both my nieces relapsed after they went through a residential treatment program a year ago. The family is distraught, however. They put God last on the 12-step list. How should we deal with it? And this is from a caring aunt.
Yeah, I think God needs to be first, second, third, fourth, all 12 steps of the 12 steps.
Amen.
And then all of the steps that follow. And as a matter of fact, the first book I wrote, From Addict to Disciple, the first 12 chapters are the original 12 steps from over 80 years ago, when God was the only higher power, and he was in all 12 steps. And after those 12 chapters, it's walking the path that follows. This is a spiritual war. This is not just an illness that we're looking to get in remission. This is a battle, and the enemy is out to rob, kill, and destroy. And so we need to keep God involved, because he is our only healer in this battle.
Amen. My step-grandson has been smoking marijuana, according to his gran and mother, and is acting out by not going to school, wanting to kill himself if they try to make him go, screaming and calling them names, wishing them dead, swearing at them. I would like to know if you have any advice on how to deal with him, and most of all, to help.
Yeah, I think with those sorts of emotions and activities going on, you really do need to call in someone for intervention, and whether it's a social worker, whether it's a counselor, whether you're at a point where the authorities need to be brought in. This is not typical behavior. This is extreme behavior. And so I would urge, getting at least a social worker, a caseworker involved to begin to get a home plan going there.
Right. Another SMS, also just a comment, Dave. Good morning. I feel counseling and then deliverance to deal with the source, as Dave mentioned. And there's a scripture here, Mark 9, verse 21. This kind come out only by prayer.
Yeah. the key is that everyone that's in addiction has some wound that has allowed the enemy to have a stronghold in there. Hosea 4:11 says that harlotry, wine, and new wine. So sexual addictions, alcohol and drug addictions, whatever the new wine is, enslave the heart. So we understand that there is this root cause, this wound that the enemy has stepped into and created an enslavement. Mm-hmm. So wherever you stand on deliverance ministry, wherever you stand on bondage to sin, we can't ignore that.
Right.
That needs to be taken care of. And that's one of the main reasons why if we send our loved one away to a secular rehab, we can't expect them to deal with that root cause. We can't expect them to say, oh, by the way, yeah, we also do deliverance ministry, or we'll see, where Satan's stronghold is and see how we can deal with that. And so people can go away to a rehab, do well for 3 months, 6 months, 12 months, who knows how long, but if that stronghold is still there, Satan's going to come back and pull that string again.
How many safe and reputable Christian rehabs do we have in the province? I've heard horror stories of Christian rehabs who actually abuse people. Mm-hmm. So are there any safe, credible rehabs that would cater for the spiritual need as well as the physical need of the addict?
Yes, there are. There's a few around. I think, if you look at a place like Victory Outreach, and I don't want to mention just one, but if you look at a place like Victory Outreach, you can see a place that's around the world, teen challenges around the world, and it doesn't have to be international to be good. What I advise families is go and visit personally the rehab that you're considering sending your loved one to. Talk to the staff. Ask for permission to talk to people in the program. Ask if they have anyone that you can talk to who's a graduate of the program. Because, I even as a counselor don't want to send people to a place that I wouldn't send my own family to.
Right.
So it's important to be able to go and check them out for yourself and ask those hard questions.
Okay. Our final SMS this morning, Dave. It says, good day, Jeremy and David. I feel my husband is an alcoholic. I'm trying to cope with this alcohol problem. He did say once to me he has a problem, but when I offered to help him, he is not receptive to that. Can I join a program that you have for the alcoholic spouse? Thanks and God bless.
Yes, and we're looking at the church in Plumstead, Abundant Life Center, as quick as April as starting up a group there on Wednesdays for spouses. So definitely just send me a WhatsApp or an SMS or an email, and I'll be in touch with when that gets going.
Awesome stuff. Dave, a couple of closing words for you during this segment.
Okay. Let me just say one thing. I didn't mention detox.
Right.
And that's, one of the things that we do need to assess right up front. Depending on the drugs that our loved one is taking, they may need detox in a hospital setting, just for the safety of their life. That withdrawal can be life-threatening, so we do need to not ignore that.
Well, what is the most dangerous withdrawal? Is it drugs or alcohol?
Yeah, that's a tough question. The most dangerous that I've seen repeatedly is heroin.
Right.
As far as one drug, and that's one that really needs to be closely medically monitored, for at least 3 to 5 days. Alcohol is more dependent on how long you've been taking it, how much you've been taking it, but those are key ones. There are other drugs that the addiction physically is not one that's going to create life-threatening withdrawal symptoms, but all of the drugs may create emotionally unstable withdrawal symptoms that does require monitoring by someone who can watch for the changes in emotion to make sure that suicidal thoughts and things like that are not jumping in. Okay. So, I just want to encourage people out there that as you're looking at what treatment option might be best, bring someone in who can go over the options with you. Use the internet, search Christian rehab, search secular rehabs, search counseling centers and see the verbiage they use, see the words they use, see the criteria that they use to evaluate what care your loved one needs. Don't try to just make it up because Johnny down the street went somewhere and had a good experience.
Right.
That doesn't mean that your loved one is ready for this same treatment.
Sure.
So do the research. Don't give up hope. Don't give up praying, but encourage your loved one to be able to start treatment somewhere and seek counseling yourself.
Okay. Just on are there any good Christian rehabs out there? Someone SMS'd in and said, the Ark is also a good Christian rehab. My son is there and he's doing very well. So we have Victory Outreach, we have the Ark. If you know of any others, because we don't leave anybody out, if you know that they are good and reputable and they do the things that they say they do, then you can let me know. I'll be more than happy to mention them as well.
Yeah, they are out there, and again, just visit them. I've heard good things about them. I've heard good things about Camp Joy. There's others out there, and they're not all coming to the tip of my tongue right now. So I don't want to offend any if I didn't mention one.
Right. We're going to be giving out Dave's contact details now. People are asking me for contact details, Dave, so let us have it.
Sure. My landline is 021-782-1117. My mobile is 073-065-0999, and I am on WhatsApp and Facebook. And Twitter, I'm at David from A to D. And my website is www.from.A2D. That's the letter A, the number 2, the letter D.com. My email is david.hain, Hain, @gmail.com.
There we go. And probably the quickest way to get a hold of you would be WhatsApp, right?
Yes.
073-065-0999. If you didn't get the details, you can give our lovely receptionist a call today, and she will be more than happy to give you those details. It's always plucked up at reception, and you can get those details there also on the Facebook CCFM 9 to 12 Facebook page. All Dave's details and a link to From A to D's website is there as well. So we look forward to more feedback about the upcoming training for the support group facilitators, Dave.
Yeah, and if anyone has just heard now for the first time that we're organizing these trainings, feel free to send me your name and your contact details and where you stay, because I'm trying to pool people together by where they stay to pick areas for venues. So send that in, and again, specifically, a shout out for people in the Macassar area, as there is a woman who's spearheading that already.
Right. Lovely. And if they want to get hold of her, they can contact you, and you will put them in touch with her.
That's true.
Does she have a name and surname? You can give the name and surname. We just won't give the telephone number.
Okay, let me pull it up here.
Okay, so while Dave is pulling that up, another last SMS. Good morning, brothers. My daughter has a friend who relapses all the time, albeit him going to many rehabs, daycare, aftercare, outpatient, so much more. And today I realized how his family, the environment is playing a part. I so much want to help him. Now he's gone. I miss him. So there you go. Thank you so much for that SMS. And I think this is what we want to do with the segment. We want God to use the segment to give us these epiphanies that we kind of, we need to wake up sometimes.
Yes.
And that's the harsh reality of the situation. We need to wake up sometimes.
That's right.
Not everything is a fairy tale.
Yeah. So my contact in Macassar is Othaline Weber.
Okay.
So that is the lady that I'll be putting you in connection with.
Othaline Weber, thank you so much for also coming on board, and I'm looking forward to the workshop because I'm really looking forward to training up as well and just getting involved in this for me as a cause. So I'm really looking forward to that training. I'm looking forward to seeing all of you there as well. David Hain, 073 065 0999, and the numbers are here at reception as well. Thank you, Dave. We'll see you next week.
Thanks, Jeremy. Have a great week.